Hello, good day everyone. I am here for a special talk on World Leprosy Day. Myself, Dr. Khalil Ahmed from Luqman Unani Medical College, Hospital and Research Center. Today I am here to shed a light on leprosy. World Leprosy Day is celebrated worldwide on the last Sunday of January. In India, it is celebrated on 30th of January every year. Leprosy has been considered as one of the most burdensome diseases in India. So we should know what is leprosy. So leprosy is a chronic infectious disease that is caused by a bacteria known as Mycobacterium leprae. So this Mycobacterium leprae, when it enters into the body, it will show its signs and symptoms after many years. So it is not a suddenly developing disease. This disease usually affects your skin and your nerves. So these are the two regions where the disease hits. Now coming to the burden of this disease, why we should know regarding leprosy, why leprosy should be in the spotlight. So for that purpose, I will show you some incidents of leprosy with some stats and some figures. So leprosy, it usually affects young individuals of age between 10 to 15 years, and it also affects those individuals who are between 30 to 65 years. So remove this thing from your mind that it only affects the old individuals. It usually affects the young individuals. Leprosy is one of the leading cause of permanent disabilities that is found worldwide. Then leprosy, it is one of the neglected tropical diseases which still exist in more than 120 countries. The world has about 195 countries. Among 195 countries, leprosy is present in more than 120 countries. So you can imagine the burden of this disease. More than 2 lakh cases of leprosy are seen every year worldwide. In the year 2020, the reported cases were about 1,27,585. In that, 7% of the children were affected. So in 1,27,000, 7% of the children were affected. So this shows high burden of the disease in children. In 10 newly detected cases, 1 will be a child. So it has heavy burden over the children as well. In the year, the stats of 2019, it shows that the disease had more burden in India. That is 79% of the cases which were reported in 2019 belong to India, Brazil and Indonesia. So India ranks top when it comes to the number of leprosy patients. So we should have a detailed knowledge regarding the prevention of this disease. Now after knowing the facts and figures, let's move on to the transmission of the disease, that how this disease is transmitted from one person to other person. So leprosy is transmitted from one person to other person through droplet infection. What does that mean? Droplet infection means when someone coughs, when someone sneezes, the droplet that is coming out of cough and sneeze, those droplet contains the particle of the bacteria. And if that droplet comes in contact with a normal person, that normal person will inhale or either ingest that droplet, and the normal person will get affected with the disease. And the infected person, when he sneezes, when he coughs, the droplets will fall on the objects, and if a normal person comes in contact with that object and touches the hand to the bare mouth and nose, then again this disease will be transmitted. Now coming to the clinical features, what are the signs and symptoms that the patient has? As I have said you, this disease or the bacteria, it affects two things. One is the skin, the other are the nerves. So the skin will be having some patches, that is some white patches over the skin which will be having less sensations. Then there will be development of some nodules over the face, and when these nodules join together, that causes a large furrowing skin which appears like a face of the lion. Apart from skin problems, the patient also has some problems related with the nerves. When the nerves are damaged, there can be spasticity in the hand leading to development of claw hand. The hand become like this. Then there will be foot drop. Then there will be sudden, in severe condition, there might be auto amputations of the fingers and the toes. So these are the certain signs and symptoms that the patient has. After sign and symptom comes the most important aspect of the disease, that is prevention. Any disease which has got higher burden, we should focus on prevention rather than going for the treatment, because prevention is far more better than treatment. So in case of treatment, the first thing that you should note is early diagnosis. When you diagnose a disease in its earlier stage, you can prevent the progression, you can prevent the transmission of disease from one person to other person. So early diagnosis is the most important thing in prevention of the disease. Then the second thing is contact tracing. Contact tracing is nothing but contacting those individuals who are in close contact with the deceased person. For example, in a family, if a single person is affected and the other family members who are living with that person, they are at a higher risk of developing the disease. So you should trace those individuals who are at a higher risk. So when you trace those individuals, then you can regress the progression of the disease, you can regress the spread of the disease from one person to the other person. Then one more thing is health education. Health education is also one of the most important preventable factor in any of the disease. So when you educate the layman, when you educate many people regarding a particular disease, then they can understand the spread of the disease, they can understand regarding the transmission of the disease, then they can prevent themselves from this disease. So educate the people by going to the schools, going to the communities, going to those areas where there is a high burden of the disease. Then apart from that, changing the lifestyle. Changing the level of the lifestyle. Like this disease is very commonly seen in those areas which are overcrowded. Overcrowding is one of the risk factors for the development of droplet infections. So reducing the crowd. Then the second thing is providing hygienic sanitary conditions. If someone is disposing the stools outside the house, then through those stools bacteria comes out, the bacteria goes into the soil, or the bacteria comes in contact with the water. And if someone comes in contact with that soil, if someone comes in contact with that water, then that person might get affected. So it is very important to have a very hygienic sanitary condition. Then a good pure water supply to home and to other office or industries. So if water supply is pure, if it is clean, then this disease can be prevented. So this is regarding the prevention. Now coming to the one more important aspect of this disease is regarding the myths and the fact. There is a social stigma regarding this disease. Whenever someone has this disease, the society, they isolate that person. The society behaves very bad with those persons who are suffering from leprosy. This behavior should be stopped. This behavior should be changed in order to motivate the individuals who are suffering from this disease. In order to provide in order to provide the dignity of the patients who are suffering from this disease. So there are various myths. I want to clear those myths. Myth number one is leprosy is highly contagious. That is wrong. Leprosy is not highly contagious. It is mildly contagious. It is not very highly contagious. The second myth is leprosy can spread through casual contacts. That is again wrong. Leprosy cannot spread by casual contacts. If you are shaking hand with a person, if you are sharing utensils with that person, then these things cannot cause what? The disease cannot spread the disease from one person to the other person. If the individual is living with an affected individual for a longer period of time, then only transmission is possible. Then there is one more myth that leprosy only affects the skin. No. Leprosy affects the skin as well as it affects the nerves as well as it affects various organs of your body. Okay, coming to another myth, there is a myth that the patient who are suffering from leprosy should be isolated from the community, should be isolated from the society. That should not be done. The patient who are suffering from leprosy, that is totally unnecessary to isolate them. You can keep them in society, you should treat them very good so that their dignity is maintained. So if the person is receiving treatment, the disease is not transmitted, the person should not be isolated from anywhere. So by knowing the myths and by knowing the facts, the social stigma of this disease can be reduced. So keep in your mind and eradicate all the myths that you have regarding this disease. I want to give some key messages before I stop or before I conclude my discussion. The key messages are, the one thing is leprosy is treatable, leprosy is preventable, it is totally curable. Many people have a myth that leprosy is not curable. That is totally wrong. Leprosy is curable, leprosy is treatable with multiple drug therapy. The second thing is minimize the social stigma and discrimination. Discrimination should not be done with the patients. Then you should behave properly with the patient, you should not isolate them. Then together we have to fight with leprosy. You should not wait for the change, become the part of the change. This is what I have to say for you. So we can together fight with leprosy and we can end this disease. Thank you so much.